Welcome to Daytime Ottawa here on Rogers TV. Thanks so much for joining. A great show ahead for you. A lot of exciting things happening. First of all, the Beaver Tails Ottawa Ice Dragon Boat Festival is coming up the first weekend of February. They have a free concert series as part of that. Bytown Museum has some exciting news because they have a huge renewal project. We're going to introduce you to a wonderful author who also has some exciting news, and a wonderful local musician, Christine Graves, who has a brand new album out. We'll tell you how you can help her celebrate that new album. And we're going to talk mental health on this show as well with the Youth Services Bureau. And with my first guest, I am joined by Leslie Scott, Manager of Media, Marketing and Communications with the Distress Centre of Ottawa and Region. Leslie, welcome to the show. Great to have you here. And this is always an important conversation, of course. Let's Talk Day. It really has brought, I think, a lot of attention to mental health. But I think, Leslie, in this last decade, would you say we've come a long way, haven't we?
We really have. I mean, if you even look at the numbers from the Distress Center as a whole, in 2020 or 2013, rather, we were answering around 40,000 calls, and now we're averaging anywhere between 55,000 and 62,000 at any given time. So, people are really starting to open up. They're starting to talk about what's going on in their lives, and they're just helping to stomp out the stigma of mental health.
Yeah, let's have another look back. I mean, you mentioned some of those numbers, but take us back to 2022 and what that looked like for the Distress Center, Leslie.
Yeah, so it was a busy year. Dealing with everything pandemic-wise the past few years has been really busy for us. But last year we were starting to come out of the darkness from the pandemic. I mean, we're still in it, but
right.
The restrictions were lessened. We were getting vaccinated. We were just kind of collectively coming together again. So our call volume averaged out to about 55,600 calls, text, and chats over the course of the year. And it was busy. I mean, that's, averaging 175, 180 calls, text, or chats a day. So it keeps our volunteers busy.
Yeah, and I think, Leslie, that's an important component of what you started offering at the Distress Center was the fact that people could text and chat, mm-hmm. because not everybody is comfortable, having that, that phone call, that one-on-one phone call. What has the response been with the text and chat, Leslie?
It's been very welcomed. I mean, before we started this, we had people messaging us on our social media asking if they could get online support. And unfortunately, we just didn't have the capacity to do so or the funding. And right now we have the funding to do it. So when we launched it in the end of 2019, we weren't sure what to expect, but it's been really great. I mean, looking at last year, it was almost 2,000 conversations we had between text and chat. And those conversations last a little longer than they do on the phones.
Right.
They average about 20 minutes versus calling because you're typing versus speaking. But people are really appreciative of this additional service, especially those who are just really not comfortable talking on the phone. And I think as we keep getting more into more social media and phones, we will lose that person-to-person phone chat a little bit more, but this is the way of the world now.
Leslie, who's at the other end of that call when somebody calls the distress line, the crisis line, the text and chat? Who are they speaking to?
They are speaking to the most wonderful people. They are volunteers. They're at the heart of the organization. These are people that come from all walks of life, all with one thing in common, and that is to help others get through a really hard time. So these people have been highly trained through a 60-hour training session with us over the course of 6 to 7 weeks. And that includes the Applied Suicide Intervention Skills Training Workshop, so that we're really prepared to talk to anybody about anything that's going on in their lives when we answer the phones.
What sort of commitment are you looking for from a volunteer, Leslie? If somebody's watching right now and they're interested in volunteering, what kind of commitment should they look out for?
It's a 1-year commitment with us, and that it's 200 hours over the course of the year, which kind of sounds daunting when you hear the big number, but when you break it down, it's 1 4-hour shift a week for a whole year. So, instead of watching a Netflix series for 4 hours, you could be helping somebody on our phone lines.
What about funding, Leslie? I know that the community has been a big part of helping the Distress Center over many, many years. Of course, you put on events, they're third-party events. Where does the majority of the funding come from?
We have wonderful partners like the United Way of Eastern Ontario. We partner with our local hospitals. We even partner with our friends up in Nunavut in the Northwest Territories to answer calls from them. And then we get funding, like you said, from events and from donations, which are really important to us, especially now as we're going into a recession and the cost of inflation and everything has been really difficult for Canadians to manage donating to charities. All charities are feeling it. So, whatever comes in our donations, we're really appreciative.
Leslie, do you and your team sort of forecast? Do you do a look ahead to each and every year? And if so, what are you looking for as far as forecast goes in 2023?
I think what we're going to see is a lot of people really migrating to the text and chat option, especially as we get back to the office, get back to our day-to-day schedules. They want something that's quick and easy and on the go versus having that conversation in somewhere in their house or their office. They're able to do it right from their phones or their tablets or computers. So I think we're going to see an increase in text and chat this year for sure. But I also think that we're going to see a bit of a decrease in terms of pandemic chat as we are coming out of the pandemic and getting back to a normal state of living again.
Since I have you here, Leslie, let's talk about some mental health tips that you can give to our viewers out there. Where would you start as far as advice goes?
Oh, first and foremost, eat well. That's one of the biggest things right now. Get your vitamins and natural goodness from your food. Try to limit the processed food. Get outside as much as you can. And if you can't get outside, at least sit near a window so that you're absorbing some vitamin D. You want to make sure that if you take medications that are prescribed to you from a family doctor or physician, that you are taking them at the same time every day as instructed so that you get the full benefits of taking the medication as it's supposed to work. And also reach out and talk to us, talk to a friend, talk to us, and really just put your mental health first this year.
Yeah, and I guess, through the pandemic, many of us have found ourselves in isolation. I know that the Red Cross has called really loneliness a pandemic within itself. Are you finding that some people are just calling just to speak to somebody because they find themselves isolated and lonely, Leslie?
Definitely. We always get calls from people who are lonely. A lot of older people will call us because they've had friends that have passed on and they feel themselves lonely at, late at night or in the afternoon when they'd be out with friends playing cards or doing their shopping together. It was really a high increase of loneliness calls and isolation calls during the height of the pandemic. So we're looking at 2020 and 2021 when we were really on lockdown and couldn't see people. Those calls were really high.
Yeah.
Now that we're sort of coming out of the pandemic, like I said, things are calming down a little bit in that sense now that we're seeing people again. Leslie,
really appreciate the time as usual. Thanks so much for joining us. Want to just remind you, you can reach out. They have a crisis line, dcottawa.on.ca is the website as well. Give them a call if you need help. We'll be back with more.